Welcome back to my channel, and in this video I'm going to talk about a very important thing which is called color blindness. And with regard to color blindness, I'm asked this question pretty frequently because I see a lot of kids, especially boys, who are color blind, and they ask me that they saw on social media that there is a type of glasses that they can wear and they will be totally cured from color blindness. So I wanted to address it here because it's a bigger forum. People can share, people can talk about it, people can ask me questions in the comment section. So please stay tuned till the end of this video because there will be a lot to talk about, okay? The thing is, let's say that boy who got the color vision glasses to tell him that, okay, you are gonna be cured from the color blindness. What can go worse with him? What can happen? What can go bad if you are getting that kind of glasses? The night vision may get worse with them because they reduce the amount of light reaching inside your eyes. Okay, a leading brand called Enchroma actually warns against this thing, that don't drive while you're wearing them on, especially at night. Night driving is the biggest problem with those glasses. Day driving is also pretty questionable. You see that? It's a questionable thing to even drive during the day. So what's the benefit then? You can't drive at night for sure, and you are questionable to even drive during the night. You can't drive them at all at night, and there is a questionable thing that whether you are able to drive during the day with those, because the contrast is so variable. It's not like the usual contrast that we are used to, and you're inside your car and you're looking at the bright world outside the car. So the car inside itself is not as bright as the real world, and the glasses, they modify based on the brightness that they are situated in. So things differ, things change. So you have a variability of contrast from those glasses in that kind of indoor outdoor environment. You see what I'm saying? So that's the problem. So that's not the best scenario for the glasses to work in most cases. Thirdly, there is a problem besides the driving, day driving, night driving. There is a thing called brain. Okay, we all grow up with the brain growing alongside us, and brain gets confused because those glasses, they filter certain wavelengths of light between the red and the green colors. So we have a huge spectrum, just like the spectrum you see if you look at the rainbow. We all have that spectrum of colors that we are able to discriminate. And these glasses, Enchroma glasses and other brands of the glasses that claim to be good, they have that color filtration mechanism between the red and the green colors, and brain never grew up like that. That's the problem. Brain is so confused about that whole scenario that what's this? What's going on? I cannot see. I am confused. What am I seeing and what am I not seeing? A lot of things are going on with the brain. So do the glasses fix color blindness? That's the biggest thing what I am circling here. Fix. The answer to that thing is no. They don't fix it. It's not a cure. The glasses basically enhance the distinction between red and green color. So it's the color distinction enhancement that those glasses are providing you. Okay, that's not a true equivalent of the actual color vision. It's not equal to. Okay, you know, in the math we say 1 + 2 = 3. You are not seeking that equivalent factor in those glasses. Just remember that. If the patient has complete absence of red or green cone photoreceptors, cone is a thing inside your eye. There are a lot of cones in the body, in the eye, that we are born with, and those cones help us see the color vision. Okay, if someone has a complete absence of red or green cone photoreceptors, these glasses will not help. Why? because I just told about that the mechanism behind the glasses working is the distinction between red and green color. You're enhancing that distinction, okay? So the photoreceptors, visual cortex, and the optic nerve are still the same that you were born with. Remember, you're not fixing those three important things in your eye, in your body, starting from the brain, okay? Starting from the brain, the visual cortex, the photoreceptors, the cone photoreceptors, the optic nerve, they are not getting any as such treatment, and they do not get any modification or cure as such, okay? So remember those things. They're important because those glasses are quite expensive. They basically take the money out of your pocket for the excitement that you're seeking, for the excitement that you are having, that, okay, this glasses is gonna make me see. It's not like that. How will the glasses help if you don't have an optimally functioning system to generate that actual sense of color vision? Remember that. These glasses cannot generate that sense of color vision, which was never there for the brain to begin with. Okay, that's the problem. Another question for your doctor, ask your doctor, please ask your eye doctor before you get those glasses, because those glasses are crazy expensive, honestly. Ask this very specific question to your eye doctor. Could color amblyopia or colored lazy eye revive at some time to somebody who finds these glasses at the age of 40 or even 25? Ask me in the comment section if you're interested in getting the answer for that kind of question. It's a tough question, honestly, but it makes sense. Amblyopia is a lazy eye. What if you have a colored lazy eye? By that I mean you are lazy from only color vision perspective. Every other perspective is good. What if you have bilateral color vision amblyopia only? That's the question of the day, okay? Ask me in the comment section if you're interested more about this. So what happened? They did a study on 48 patients. This Dr. Robaldo, and you can find this research at this link. This professor and his colleagues, they conducted a study with 48 colorblind volunteers and found that these glasses, in chroma glasses, they don't cure color blindness. That's what the research publication says. None of the participants noticed any improvement to the colors of their surroundings when looking through those glasses. There was only one female who appreciated it a little bit. You know what? Color blindness is way more common in males, okay? Check out with your eye doctor about that. Ask me in the comment section if you have questions about that. But yeah, the female, she found a little bit of benefit, but 48 patients had no benefit. They said it's useless. It was useless for them. They said none of the participants noticed any improvement to the color of their surroundings when they were looking through those crazy expensive glasses. So be careful before you spend that money. What does the National Institute of Health, the NIH, say about that? This is a link about the actual full publication. I have put an extract of that they also said it does not clinically significantly help you. Look at this. That's the wording of that. They do not provide clinically significant evidence that subjective color perception has improved. So there is no improvement, basically. Okay, clinically significant improvement is important to tell the patients. That's why I never prescribe these glasses to my patients, because they're gonna come after me. Am I making money out of it or what? So that's why the NIH said more studies, more research, more things are needed at this point before you start prescribing something like that, because no, we need more color vision devices. Maybe something needs to come out. Of course, something need to be there. Okay, so if you have more questions about this topic, please ask me in the comment section. Share it with your eye doctors. Ask them more questions and ask me in the comment section. I hope it helps. If you have questions, again, ask me. Thank you so much. Have a great day. Bye-bye.